Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pacheck na natin yan. So, pinacheck namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mga binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, last episode we discussed thyroid cancer uncovered, navigating diagnosis, treatment, and recovery. I would also like to thank at this point our dear VIPs for joining our special event last night via Zoom. Thank you so much for attending. Interesting questions were asked during the AMA portion, and most importantly, answered by our experts, Ms. Jhen and Mr. Shyan Lim. And this week, discover how cancer and metabolic illnesses patients can benefit from using PPARS, because tonight's interesting topic is entitled Cancer Care 2024. Enhancing treatment outcomes through diet and PPARS. Tonight, we'll explore the role of dietary patterns in supporting cancer patients, focusing on how specific nutrients and dietary choices can positively impact treatment adherence and recovery. Additionally, we'll discuss PPARS and its emerging role in potentially improving patients' chances on successfully completing their cancer treatments. So we extend our sincere gratitude to each and every one of you for tuning into this webinar. And we encourage you to share this online event to your friends and loved ones who will benefit from the insights shared here tonight. But at this point, before we start off, I'd like to share some exclusive and very exciting promos that are ongoing here in Simply Nature, because you are actually in a treat. Because starting yesterday, November 13, I'd like to call on our VIPs. Please listen carefully. All right. Starting yesterday up until next Friday, that's November 22. All right. We have an exciting exclusive VIP promos that awaits our direct and website buyers only. Okay. So what are these? Well, very, very easy. You will get 2 sachets of Cleansing Plus for a pack of PPAR soft gel capsules, and get a 5 free sachets of Cleansing Plus for 3 packs of PPAR soft gel capsules. And this is the best one, okay? Listen carefully, because you can get a free tablet of PPARS, free bottle of PPARS tablet when you buy PPARS liquid and powder extract. But that's not it, okay? Exciting news, because Simply Nature family, on top of that VIP promos, okay, we are also offering a limited time promo, all right? Limited time promo that you won't want to miss, okay? Hurry, because this promo is up until November 30 only, okay? Shop now at official Simply Nature website. At the, sorry, www.simplynature.asia, because you know what? You can actually get a discount of more than 250 pesos, okay, when you purchase PPARS powder extract or PPARS liquid extract. Another one, you can get a discount of 200 pesos when you buy the tri-pack or the 3 packs of PPARS soft gel capsules. So what are you waiting for? Check out these participating items on our website, and please reach out to your respective CSOs or client service officers to know more about this exciting promos. Okay, all right. Well, without further ado, let's dive right in. Okay, please note that we will be having a what we call Ask Me Anything portion eventually after the discussion. So please feel free to drop your questions on the comment section. All right. Well, leading our tonight's discussion are distinguished health experts. We will now go through our honor of presenting our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Tan Kalalan. Let's all watch this.
Hello everyone, this is Dr. Jansen your lifestyle medicine doctor and integrative oncologist. Today we're going to talk all about food and cancer, no? What kind of food should the cancer patient eat? What kind of dietary pattern should the cancer patient follow? What are the do's and don'ts? And are there exceptions? Okay? So, before we begin with the recommendations, we have to first understand how cancer grows, how cancer metabolizes its fuel. Okay? So, this is the metabolic theory of cancer. So, cancer, they have dysfunctional mitochondria. So, mitochondria is the powerhouse of the cell, and the mitochondria, normal mitochondria assimilates plenty of oxygen. Plenty of oxygen to create ATP, which is the energy of the cells. In cancer, the mitochondria is dysfunctional. So, cancer cells cannot utilize oxygen to create energy. What do they use instead? They use sugar through the process of glycolysis. Another nutrient that cancer cells assimilate is glutamine. Okay? So, first, let's discuss sugar. So, cancer cells, since they are very metabolically active, they are replicating again and again without control, their energy requirement would be very, very high. And since they don't utilize oxygen because of a dysfunctional mitochondria, they would assimilate high amounts of sugar. So, as a cancer patient, if you consume high sugar foods, then these sugar would fuel the growth of cancer. So instead, what you have to do is to cut down on sugar. Make sure there's no insulin resistance present inside your body to ensure that there would be minimal amount of sugar that your cancer cells would consume. There are also medications that we can use to help inhibit the assimilation of sugar by cancer cells, which I will share with you later. Now, let's talk about glutamine. What is glutamine? Glutamine is an amino acid, and amino acids are building blocks of protein. Foods that are very high in glutamine are your animal food products. If you want me to be more specific, these would be your beef, pork, chicken, fish, egg, seafood, etc. Dairy as well. So again, the animal food products in general are very high in glutamine, and glutamine feeds the growth of cancer cells. So what you have to do is also to limit the amount of glutamine that your body takes in. Okay? There are also medications that we can take to inhibit the assimilation of glutamine by cancer cells. No? Again, I will share them with you later. Now, knowing cancer cells assimilate sugar and glutamine, we now know, or we can now make an educated recommendation when it comes to the diet of cancer patients. So, a cancer patient would have to consume what kind of diet? It has to be low in animal protein. Because, again, animal protein is very high in glutamine. Okay? On the other hand, the diet should also be low in sugar, not carbohydrates. Although sugar is a type of carbohydrate, but not all carbohydrates are bad. Why? Because there are two kinds of carbohydrates. You have complex carbs and simple carbs. What we do not want are the simple carbohydrates or the simple sugars. These are your sweets. Okay? Fruits would contain a higher amount of simple sugars, specifically fructose. So for cancer patients, while it is still advisable for you to eat just a little bit of fruits, no, because there are nutrients found in fruit that you cannot find elsewhere, you have to limit the amount of fruits that you eat every day. So what I usually recommend for cancer patients is to just consume one serving of your chosen fruit, no, each day, and you have to eat the fruit at the end of the meal, at the end of a full meal. Okay, so the sugar absorption would not be too fast. Okay, so speaking of carbohydrates, the other type of carbohydrate are complex carbohydrates. These are your fibers. Fiber is what you want. So why? How does fiber benefit a cancer patient? Fiber acts like a sponge, no, when you eat them. So since it acts like a sponge, it helps with the controlled absorption of your sugar, your fats, and your protein. If the absorption is controlled, it's not too fast, then there will be less chance for the cancer cells to consume and to eat all these nutrients. Okay? Also, the fiber would feed your gut microbiota. Your gut microbiota is very important for your immune system because the gut microbiome produces anti-cancer molecules as well, no? Especially molecules or fatty acid, specifically short-chain fatty acids that lower your risk of developing colon cancer. Now we've talked about sugars, carbohydrates, and amino acids. What about fats? Okay? Cancer cells are also known to assimilate fat and cholesterol. Okay? However, not all fats should be eradicated from the diet. What we want are omega-3 fatty acids or your unsaturated fatty acids. What we do not want are saturated fats. Saturated fats are solid in room temperature like your butter and margarine. Typically, foods rich in saturated fats are processed foods, meat, cooking oils. So these are 3 food items that would be in your best interest to avoid. So in conclusion, the default diet for a cancer patient should be a whole food plant-based diet that is low in fat and devoid of animal food products. Now, what's the exception to this diet? If a cancer patient is too thin already, or if a cancer patient is cachectic and underweight, then this dietary recommendation should not be followed anymore. For patients who are cachectic, who are very thin, who are underweight, you have to feed them as much food as they want. Okay? Whatever food they would want to eat, allow them. Because they need calories in order for their weight to go up. But of course, you would have to always remember that you still need to feed them vegetables, okay, so that they get the proper nutrients, the proper antioxidants that their body requires. We're talking about food dietary patterns here, and these are habits or these are lifestyle factors that it's typically very hard to change. This is ingrained with our life already. And the reason why some people have cancer in the first place was because of a poor diet. So how then do we start implementing changes to a cancer patient's diet if a cancer patient, say for example, hates plant foods or hates vegetables, no? So the first step is to list down all plant foods that the patient is already eating or the patient loves. Start from there, then slowly introduce other plant foods to the diet. Of course, the challenge there would be, would the patient get all the nutrients that he or she needs? So this is when we can begin supplementation. We can begin supplementing with Simply Nature PPARS. Since Simply Nature PPARS is a microalgae, it has very complete nutrition. It can also help you detoxify already because all the toxins inside the body of the patient would be removed as well, no? Once you begin taking microalgae. And then once these things are already in place, start taking out foods that are contributing to cancer growth in the patient's diet, no? So number one that you have to remove would be processed foods, especially ultra-processed foods like your pastries, your sweets, sweetened beverages, candies, your fried foods, processed meat as well. So start removing this. Start by improving the health of the patient. No? Once the patient's health improves, it would be more difficult for the cancer to spread. It would be more difficult for the cancer to grow. If you need more assistance when it comes to metabolically addressing the cancer, we can actually use 2 medications for off-label use, namely metformin and atorvastatin. Metformin is a medication used for diabetics. Metformin is an insulin sensitizer, and metformin can help inhibit the intake or the uptake of cancer cells, of sugar, fats, and glutamine. Another medication that we can take advantage of is atorvastatin. Atorvastatin is an anti-cholesterol, anti-dyslipidemic medication. No? It lowers cholesterol. Cancer cells also love cholesterol. How do cancer cells utilize cholesterol? It's for hormone production and for making their cell membrane stable. Okay, that's what cancer cells utilize cholesterol for. Also, if studies have been shown, no, if breast cancer patients, for example, are on atorvastatin, their mortality rates go down by as much as 15%. Okay, so this is a significant improvement in terms of survival rate and mortality. So I would actually recommend these two medications in addition to our regimen, no, the usual regimen for cancer patients to improve health outcomes. And that's it for our webinar tonight. I would see you in the AMA segment.
Learned so much from that discussion. We are now in the what we call AMA or Ask Me Anything portion. So let's not keep you waiting. I can see a lot of questions are coming in now, also privately. And now to answer our questions in this modern world filled with noise of different health opinions, trust the ones from the expert. To answer our questions for tonight, I'd like to introduce a successful entrepreneur and a seasoned international speaker on a wide range of topics, from personal success to healthcare. He is the CEO and founding director of Simply Nature International. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila. So good to have you. So good to be here. So good to see everybody. Thank you for all our viewers. Yeah, let's start.
All right. Okay. So this question was thrown to us privately by one of our viewers. The question is, can a dietaries or specific dietary patterns help manage the side effects of cancer treatment, such as nausea, fatigue, and weight loss?
Yeah, the answer is, of course, yes. You know, many times in conventional medicine, when we talk to doctors, they just say that just take our medication and you can basically eat anything. That is actually not true, right? So one simple example is if you have sore throat and fever, if you take like fried foods and chocolate, it's going to make your sore throat worse. This is something we all know instinctively. So for cancer patients, the number one enemy that you want to avoid is inflammation. So anything that is fried, a lot of animal protein, all these lead to inflammation. So for example, if you have gout, right? If you have gout, if you eat a lot of meat, your joints will hurt and ache a lot. Why? Because it's acidic and it will stimulate inflammation in your body. So same for a cancer patient. You want to take things that are mild, right? So traditionally, the food that you eat when you are sick, you know, mongo and all these will be helpful for you to recover from your chemotherapy sessions. So imagine if you had chemotherapy, you don't want to be taking fried chicken and chocolates and everything immediately after that. That's not going to help with your recovery. So the best diet to complement the recovery during your chemotherapy is definitely something light and refreshing. So easily green vegetables, right? Vegetables, things that are light in salt, that's going to help your body recover. Of course, many oncos will also advise you to take meat because the reason is because you need protein. You need protein. And when you go for chemotherapy, many patients lose weight and muscle. So so that's why the doctors ask you to eat meat. However, if you take meat, it's actually going to make your situation not so good either. But if you don't take meat and you don't take much food because you have poor appetite, then that's also going to affect your recovery. So what's the best thing you can do? Okay, the best thing you can do is to take vegetables. But nowadays, there are things called vegetable protein shakes, right? So don't take your whey protein shakes. You can go to Healthy Options or any of these organic stores And now you can buy, even the big brands, you can take vegetable-based protein shakes. So these are usually based on green peas and legumes. Even Enlean, right? Is it Enlean?
That's right.
Ensure.
Ensure.
Okay, in
Plant-based
Singapore, the brand is Enlean. Here is Ensure. Even Ensure has a vegetable version or a vegan version. So take those. Those will help you in your recovery with chemotherapy, radiation therapy. Yeah.
Excellent. Well, sir, just before we go to our next question, I'd like to, of course, greet our viewers for tonight. Of course, our dear VIPs also. No, Miss Noemi Veras, Edna Aveo. Of course, hi, Miss Jeanette Koo of Child House. Thank you for
Yes, hi
joining
Jeanette. Long
us.
time no see.
Yes. And there you go. Oh, Remjoy Rojas also. Thank you. Thank you for joining us tonight. Okay. So for the next question, sir, question is, what is the role of the antioxidants in the diet of cancer patients? And are there any risks associated with their consumption during cancer treatment? Oh,
No.
this question.
Okay, and antioxidants are so that you can get rid of the oxidative stress, right? So when you are going through cancer treatment, chemotherapy drugs will cause oxidative stress. Because chemotherapy drugs are, I guess, let's put it in a simple way to understand. It's toxic, right? It's acidic. It's stressful. It stresses out the cancer cells and kills it. But that means it also leaves oxidative stress in your body. So taking antioxidants in supplements, in the choice of foods that you take is going to be important. Are there any side effects? Does it reduce the impact of your chemotherapy? The answer is no. I don't think it's going to make much impact when it's talking about diets, all right? When it comes to multivitamins and all that, what you may want to do is on the day that you're going for chemotherapy, immediately after that, you don't take your antioxidants for 1 day, okay? And then why? Because your chemotherapy has a half-life, usually 12 to 24 hours. So that means the most effect of your chemotherapy is in the first 12 hours that you go for your chemotherapy. So after that, after 24 hours, which is about 1 day, pretty much anything that your chemotherapy is supposed to help you with is already done. So then you can really take your antioxidants to quickly help your body recover. All right. So now the best supplements to take is actually Simply Nature PPARS. In fact, I'm just preparing our business to business, our med reps, because Simply Nature will be presenting to pediatric oncologists this coming 2 weeks from now. And we were just looking at the mechanism. Our supplements and our protocols protects the healthy cells from oxidative stress and chemotherapy side effects. Now, because it protects the healthy cells, does it protect the cancer cells? This is a question where all the oncologists will want to know. So the answer is no, because the way our Simply Nature PPAR works to protect the cells from chemotherapy damage, from oxidative stress, from mitochondrial damage, all right, all this, it only works on cells that have intact mitochondrial pathways. However, cancer cells have distorted, unusual, not normal mitochondrial pathways. Because of that, they don't receive benefit from the protection that Simply Nature PPAR gives to the healthy cells. So that is why when you're undergoing chemotherapy, you can take Simply Nature PPAR protocols. It will protect the healthy cells, but it will not reduce the impact of your chemotherapy. All right? So that's how it works. So that's the science behind it.
Thank you, Sir Shyan. It's quite technical, but what I like about what you said, and I want to echo out, is that it can protect the healthy cells, but can still make your chemotherapy very much effective. Okay. That's very, very encouraging. Okay.
Sheila, I saw a question from Jhen Chang-Ang. How does PPAR work on lupus patients?
Yes.
I would like to tackle that. Okay. Jhen, you know, when you look at our literature, or when we say that Simply Nature PPARs boost the immune system of the patients, right? That's why it works for cancer patients, so on and so forth. So I think for lupus patients, you are thinking, oh my God, lupus, patients, the immune system is attacking your own healthy organs. So if I boost the immune system, will it make it even worse? Because then I have a stronger immune system attacking my healthy organs. So the answer is no. Okay, Simply Nature PPARS works by modulation. Okay, it doesn't work by forcefully strengthening. So what's the difference, or what's the meaning of modulation? Modulation means to adjust to peak or normal. All right, to adjust to the right way your immune system is supposed to work. So for lupus patients, your immune response is irregular. It is not normal. In fact, your immune response is overactive, right? So because Simply Nature PPARS is an immune modulator, it's like a Meron, a thermostat in your aircon. If you set it at 25 degrees, diba, if the temperature drops to 23, the aircon will not blow anymore so that the room temperature can go back up to 25. If the room temperature goes up to 27, your aircon will kick in to cool the room temperature back to 25. So 25 is the benchmark. So what your thermostat is doing is modulating or adjusting to make it hit the peak performance, which you set at 25 degrees. Protocols on the immune system, right? We modulate the immune response. So it doesn't mean that we dampen the immune response. Neither does it mean that we heighten the immune response. We help the immune response react normally. So because lupus is an immune response that overreacts, when you take Simply Nature PPARS, it will help your immune system not attack your healthy organs. So we actually have patients who are lupus patients. They take, we suggest taking the soft gel capsule because for lupus, it's a long-term thing, all right? And it's, unless you're a very serious lupus patient that you need immediate relief, immediate care, this is something that is not like cancer where you're fighting against time. In fact, for many lupus patients, it's chronic lupus. You've been surviving with it for years. So the solution is here now, all right? You can start with Simply Nature soft gel capsules, 1 capsule a day and 10 micro tablets twice a day. That will be the dosage. What will happen is over time, how long? You will see good results within a month. All right, you will see good results within a month. What do I mean by you will see good results? You should see the symptoms of your lupus start to diminish. Okay, that means lower. So for the direct patient that we actually have experience with, don't forget, Simply Nature distributes our products through doctors. Okay, so the doctors cannot just give us their patient files. All right, so the one that is a direct patient that I dealt with, she not only has she has chronic lupus and she also developed PCOS, right, because of lupus. And what happened is it took about 2 months, all her symptoms started to disappear and she didn't have any lupus attacks. And she's a chronic lupus patient. So, and then when I checked with our doctors and with our factory in Taiwan, then I found out that, oh, there are actually many lupus patients over there also who are doing well. So that's how our Simply Nature PPAR works on lupus patients, okay? And it's the same way it works on eczema and psoriasis, right? So eczema, psoriasis, lupus is the same mechanism. They are all, that means your own immune system is attacking your skin for eczema and psoriasis. For lupus, it's not only attacking your skin, it's actually attacking your organs, okay? So it works for psoriasis, it works for eczema, it works for lupus. It works by helping your immune system react normally so that it will stop attacking your own body, which is abnormal.
Excellent. That's very encouraging, Sir Shyan. Thank you so much. Okay, another question thrown to us privately. You like this one. The question is, how can cancer patients manage changes in appetite and taste due to cancer treatment through their diet? I heard there are people going through chemotherapy that taste like they taste metal.
Everything tastes metallic after that.
Exactly. Yeah.
Okay. The answer is you can't. I'm sorry. This is one of the side effects that your body is undergoing, because when you go for chemotherapy, your body is reacting to the drug mechanisms, right? So one of the side effects is that it does affect your taste buds. So if that affects your appetite, then supplementation is an important strategy lang. Because if your taste buds change when you eat food, it's very weird, right? It's very weird, and you might end up eating less. Okay, so as a cancer patient, you do need to make sure that you get enough nutrients. It's very important to have energy to fight your cancer. So what you can do and what you should do is start to take supplementation. So you can take Simply Nature PPAR tablets, because someone also asked, they are taking quercetin. Can they take Simply Nature PPAR tablets? Oh, definitely so. Definitely so. I will even suggest that you take our extracts as well. All right, just speak to one of our CSO, make comments, and one of our pharmacists and CSOs will talk to you to answer your questions. Okay, so for changes in taste buds, try different foods. Okay, try different healthy foods. So the thing about changing your taste buds is that the food that you may love, like for example, chicken, will taste weird. But if you try eating carrots, it might actually taste nice. Okay, so what happens when your taste buds change is that how you taste other food may also change. So some of the food that you did not used to like but are good for you, like vegetables, might actually taste nice. So that's one of the strategies you can do. Where when it comes to can you actually solve this issue? No, this is actually part and parcel of the immediate side effects of your medical treatment. But just bear with it, because chemotherapy has a limited number of cycles that you go through. After that, things will recover. Or it may take a little bit of time. Sometimes there's a delay before your taste buds come back to normal.
That's right. Well, I hope this answer of Sir Shyan would not only help the patients out there with ongoing chemo, but also the caregivers who are taking care of the patients. And I'm sure they understand now, why their patients are quite irritant at times. Okay, well, another question coming from Cherry May. She's an engineer from Cabuyao. Okay. Can PPARS treat breast cancer? Very straightforward.
The answer is yes. The answer is yes. Okay. Can it be used as a approach to manage and treat your cancer? The answer is yes, but that's not the complete answer. Okay. The complete answer is no cancer treatment should be taken alone. All right. Because cancer itself is a tough disease and it's life-threatening. So I'm not going to say take only Simply Nature PPARS. No, all right. I would say you have to take a comprehensive, honest approach to look at your cancer. Okay. Do we have cancer patients with breast cancer taking Simply Nature PPARS and totally recover? Yes, we have. Do we have cancer patients who take Simply Nature PPARS, the cancer stopped growing, but it didn't totally disappear? Yes, we have also. So don't be misinformed. Sometimes we hear success stories that, oh, this person cured their cancer naturally. But we also must remember there are also many stories where a person tried to cure themselves of cancer and it didn't work. Okay, one of them is actually someone that I know, that I work with. She actually tried to cure her cancer totally naturally. And what happened was that the cancer got worse because her type of cancer was a complex cancer. In her breast, she had more than 4 types of different cancer cells. And it was aggressive. So she didn't want to go for surgery. She didn't want to do chemotherapy. In the end, she just went natural. Then it became really, really bad. So bad that she had to go for chemotherapy. And then she survived. She did well. Okay, when she went for chemotherapy, that's when she started to confide in me that she has breast cancer. And then I encouraged her to go for chemotherapy, and she also used Simply Nature PPAR extract powder. She did well. In fact, she went into remission. Then she stopped taking the PPARs, and a little while later, I heard that she had a recurrence. And then it was very aggressive, and then she did not make it. So again, there are many aspects to cancer that we should know. So for this person that asked, the straight answer is yes. The complete answer is please look for a complete approach to treating your cancer. Okay. Now, if you're first stage, second stage, and your cancer is operable, that means you can use surgery. If you're first stage and you can use surgery, if you want to go natural first because you don't want to do surgery, yeah, you can. Okay, you can. But you must give yourself a red line. That means if it moves from first stage to second stage, despite using your natural treatments, then you should now quickly consider surgery and chemotherapy and not give up your natural treatment. That means do it together. Okay, why? Because cancer, for breast cancer, first stage and second stage, your success rate is actually 90%. All right, but when you hit third stage and fourth stage, it starts to drop until like 40-60%. So why would you risk when your cancer is almost a sure thing that you will recover? Why would you allow it to reach third stage? Okay, so this is the thing for all of our viewers out there. Yes, can Simply Nature be one of your primary protocols if you want to treat cancer naturally? Yes, you can. But if you're young, if you're not an 80-year-old man or a woman, imagine if you're 75, 80 years old, you might be thinking, I don't want to go through chemotherapy and surgery. I just want to enjoy as long as my life as possible, right? And that is a valid option. But if you are young, if you're in 30s, 40s, or early or 50s, right, please make sure you explore the whole spectrum, okay? So, yes, if you want to go all natural, you need to be very disciplined. Not only taking Simply Nature PPARS, you have to make sure your lifestyle is correct. You must make sure you're no longer in a stressful work environment. If you are very angry with someone and don't want to forgive the person because the person made you very angry and you carry this bitterness inside you, you also have to let that go. Okay, because all these things are part and parcel of treating yourself naturally for cancer. Are there people who successfully do that? Yes. But many of them need professional assistance. So you can make a consult with Dr. Jansen if you really want to do it naturally, okay? Or even Dr. Jhen. Dr. Jhen is someone who actually treats cancer patients totally naturally, totally naturally, just using vegetable lifestyles and Simply Nature PPARS. But as a doctor, he also sees some patients and he will tell them, your cancer cannot be treated naturally, it's too aggressive, please go for chemotherapy. So what you want to do for this viewer is you want to make sure you meet someone who is objective and is for you and not for his treatment. Some people will tell you, die, take chemotherapy, or die, be natural. You want to meet a doctor who is actually, for example, he's specialized in natural, but he is honest with you and care enough for you that he'll say, although I'm a natural doctor, I'm telling you for your case, you have to see the conventional doctor. But I can help support you through that whole process so that you don't suffer from the side effects of chemotherapy. I hope this very long answer to a short question, right? I gave you a direct question, but I want to be responsible. I want to make sure that your approach to cancer is not just on a prayer and a hope, okay? Yes, our product has successfully helped patients to get well from cancer totally naturally, but that is not the approach that I would suggest for you without knowing your full background and your full information.
Exactly. I like all the things that you've said. Because of that, I just remembered, I just had a meeting with Doc Joy today. I just want to say hello, Doc Joy. Okay, going back actually to Infanta Quezon. Okay, well, another question. This is quite specific in terms of breast cancer as well. So she already finished, coming from Miss Remy Joy, she already finished 4 sessions of chemotherapy. Thankfully, all right, the tumor got smaller. Okay?
Oh, wow.
Thank you, Lord. On the left breast, previous mastectomy. Now, she was advised by her onco to be operated or to go for surgery. What's your advice on this? So it's a case of chemo first, then surgery. Okay.
Okay. One thing for you to know, which I'm not sure your doctor told you or not, surgery is not an option that is always on the table. Okay, that means if you wait a little bit longer and if the tumor spreads, you can't go for surgery, or you might have to go for a full mastectomy again, right? Now, if the tumor fuses to your rib cage, your bone, then you can't operate also. So, okay, so just to let everybody know, don't think that surgery is something that you can always do. No, there is a window. So if the window passes, right, it's not an option anymore. Now, I've spoken to many, many doctors, and this is my conclusion, right? surgery is really one of the best solutions to cancer because you remove the tumor, right? You remove the big tumor. So will that be small cancer cells left in your body? Of course. Even if you don't go for surgery, there will be cancer cells left in your body, right? But you already remove like 95% of all the cancer cells, which is the big tumor. So it leaves less cancer cells in your body for your body to clean up and fight. So just from a very basic, simple way of looking at it, it makes sense to go for your surgery, right? So the next thing now is surgery risky? Every surgery has risk. Okay, so now the thing is, look at your age. If you are not in your 70s, right, then surgery is less risky. And today, many surgery is not very invasive also. You know, I was talking to Doc Jimmy. I said, Doc Jimmy, if you have to do an operation on the lungs, right, and someone asked for lung cancer, I said, how big do you have to cut open the person's rib cage, open his bones and everything? No, he said, no. Then I said, how big is the cut? He said the cut is 5 centimeters, like this, like your thumb, smaller than your thumb, or maybe the length of your thumb. All right, that's how big the incision is only. So even surgery methods have changed tremendously over the years. Okay, so if you are looking for a good surgeon, but of course, you know, if you pick a wrong surgeon or you pick a wrong doctor, things might not turn out well. But if you're looking for a good surgeon, Dr. Jimmy, who we work with, is really, really very good. And not only is he good, many of his patients, actually, we overhear when we sit outside waiting for Dr. Jimmy, how the patients say that he's a very caring doctor and very warm and loving. So if you need a good surgeon, you know, just type it up there. We try and link you up to Dr. Jimmy. So the option is, I can't make a full comment right now because I don't know your case in specific. Now, if you really want a strong opinion so that you can decide, right, I would suggest you make a consult with Dr. Jansen. Okay, he works with Dr. Jimmy. So he is in a good position. He knows about the surgery. He knows about integrative approaches. That means non-surgical. He also knows Dr. Jansen does not do chemotherapy, as in he does not administer chemotherapy. But yet he will tell you to go for chemotherapy if it's good for you, which means this is an honest doctor. He can't make money from you because he doesn't sell chemotherapy, he doesn't administer, but yet he will tell you to do that. So you really want to find a doctor that is willing to refer you to someone else. That means he's really caring and trying to choose the best thing for you. Okay, so I would suggest that. But to answer your question, yeah, I would seriously look at surgery because it's the most effective way to get as many cancer cells out of your body in one shot as possible. And that leaves less cancer cells in your body for your body to fight. Now, you want to make sure that as you go into surgery, I would definitely recommend that you take Simply Nature PPARS tablets and soft gel capsules. Why? Because you want to make sure that your healing process after the surgery is fast and your immune system is strong, going in and coming out of your surgery, so that after the surgery, there are less cancer cells in your body and your immune system is strong and intact to take advantage of the fact that the tumor is out and that they only need to do cleanup. Okay, and I'm sure after the surgery, your doctor will probably recommend you chemotherapy again. And then you'll be thinking, why would I need chemotherapy again after my surgery? Because like we said, there will always be small cancer cells left over. So the chemotherapy is meant to kill whatever small cancer cells. It's like you already killed the main army. Might as well kill the small one, right? Don't give them chance to come back. So again, when it comes to chemotherapy, your concern will probably be, what if it hurts me? I'm already recovering from surgery, and then I take chemotherapy, it makes me weak. Will that give the cancer opportunity to fight back and things like that? Those are questions that are true and valid. So my answer to you is, yes, it's true. Chemotherapy will hurt your healthy cells if you don't do anything to protect it. The good news is you can take Simply Nature PPARS, extract liquid, when you are taking chemotherapy, the cleanup chemotherapy. So it's going to do two things. It's going to protect your healthy cells. It's also going to help the chemotherapy. It's also going to help your immune system clean up the remaining cancer cells, which is what the chemotherapy is supposed to do also. So you have a double left and right punch, all right, from the chemotherapy and also from the extract liquid. And the extract liquid also protects you from the side effects of the chemotherapy, which makes the everything work. Okay? I hope that's helpful. Is it helpful? Okay, yeah.
I'm sure it is very, very helpful. Okay, for next question. Yeah, you have actually noticed this question earlier. The lung cancer, can this medicine cure lung cancer? This is one of the most difficult cancers to.
Yeah, okay, hold on. Okay, Susan. Okay, great, Susan. I'm so glad that I'm so glad that it's helpful to you. All right. Yeah. Because I actually really don't like people who just push, or doctors or medical practitioners who only push what they believe in. For example, a doctor that is natural, he only push natural. A doctor who is a surgeon, everything must do surgery. A doctor who is chemotherapy, everything is chemotherapy. Don't do natural, don't do surgery, only do chemotherapy. No, I think, when you meet a doctor that says only that, then, what you want to hear is doctor say, for your cancer, for other cancers that, this approach, we will use a different approach. But for your cancer, this is the best approach. I think when you hear a doctor says that, that's probably a good doctor. Okay. Yeah. Let's go to the lung cancer. We actually have a medical report, clinical research that shows that when you take Simply Nature liquid extract, the lung cancer cells actually die. Okay. It will induce lung cancer apoptosis. Okay. What is apoptosis? Apoptosis is a medical term for a very simple thing called programmed cell death. That means basically the cell will die by itself. Okay. The Meron is an off switch for your cell. So what happens is when you take Simply Nature liquid extracts, it has been recorded and shown that it induces and increases lung cancer cell apoptosis. That means the lung cancer cells start to die on their own. Okay, so it's effective in killing lung cancer cell. Now, can it cure your lung cancer? So then again, there are many factors, right? If you have small cell lung cancer, that's very difficult and very fast, right? If you have large cell lung cancer, it's a lot slower. So what other treatments are you doing? Just imagine, let me use an example which is easy to understand in Philippines, because in Philippines, one of the Filipino hero is Manny Pacquiao, right? We all know Manny Pacquiao. He is a hero that brought so much pride not only to Philippines but to the whole of Asia, because he's the greatest of all time, and he is not an American or Caucasian, he's an Asian. So that's wonderful. Okay, so imagine Manny Pacquiao go into a fight and he can only do left hook. He cannot do jab, he cannot do uppercut, he cannot do roundhouse. He can only use the left hook. Can he win the fight? Maybe. But is it going to be easy for him? No, because he can only use left hook. If you get hit by Manny Pacquiao's left hook, will it hurt? Yes, it will. Okay, but can Manny Pacquiao win on a left hook alone? Maybe it's difficult. So that's how I'm answering you, right? Can Simply Nature PPAR extract liquid kill lung cancer cells? Yes, it has been proven, clinically proven, and our patients do very well on it, that induce lung cancer cell apoptosis. That means the lung cancer cells start to die. So now you have one left hook. That's Simply Nature PPAR. Like Pacquiao's left hook, guaranteed to hurt, guaranteed to make your opponent see stars. But is it enough to win the match? It depends. If the opponent is weak, maybe only a left hook, Manny Pacquiao can win. But if he's fighting another world-class boxer, he will need his right hook, he will need his uppercut, he will need his body punch, he will need his jab. Right? Again, so this is what I'm trying to share with you. I can say with great certainty and conviction, yes, the Simply Nature PPARS, it will work to kill your lung cancer cell. Is it alone? Is it going to be enough? It could be, but we won't know because I don't know your specific condition. So what I would suggest is you take a comprehensive look at it. So how do I pair up Simply Nature PPAR liquid? Okay, number one, if let's say you're all natural, Meron, you're really all natural, all right? Then I would tell you, if you're just gonna go on natural, you definitely have to change your lifestyle. All right, your diet must be very strict, no meat. Okay, and if you are thin, you need protein, then you have to go and get some plant-based protein shake. Eat vegetables, be very disciplined, must go for walks, even if you're tired, you don't like it, you don't feel like it, you must go out for exercise. If you're in a stressful job, you have to stop that because that's going to be very difficult. If you can't do all that, then going natural is not a good strategy, right? Because you can only do one part of the 6 parts that you need to do for natural therapy. Then you can combine it with chemotherapy and Simply Nature PPARS. So I give you one example. There's actually a patient, and she's actually an accountant. So number one, she cannot stop her job. So can you imagine, she was 3rd stage breast cancer. She is still during tax season working until 10 p.m. at night doing the taxation. So I guess it's important. Maybe her family really needs the income. So she cannot stop her very high paying job. Her job is obviously very stressful. So what she did was she went for chemotherapy. Because she make a lot of money as a top accountant, she can afford to take our Simply Nature liquid extract and take chemotherapy. And guess what? She is in remission. It's more than 5 years. She has survived her breast cancer and she's doing well. And she's healthy as well. Okay? So why? Because she got no time to go to the province and be relaxed. Despite being a cancer patient, she still have to do her high-stress job. So she chose an option, take conventional, boost it with natural, and then this will work for her because this allows her to still work her job. I hope when I'm sharing tonight like that, it gives you a good idea how you can treat your cancer. Right? Because I don't want to just give you hope. And I hear too many sad stories. I heard on both sides, everybody. I've had patients who trusted the conventional medicine, and then after spending 6 million pesos, the doctor said, there's nothing we can do for you anymore. And then the patient takes liquid PPARS, and actually starts to feel strong. But then in the end, what we could only do for the patient is suddenly the patient become very strong, very alert. She was able to spend a good 1 month with her family, but after that, she still go because she went through too many sessions of chemotherapy without and doing anything to support her recovery during that period. So that's one aspect where a person who trusted only the chemotherapy was disappointed. But I also met, everyone, I've also met people who go all natural. All right, and then it also didn't work out. So on both sides, there are people who go all natural, everything okay. There are also people who go for chemotherapy, don't even feel tired, hair don't drop, don't even take any supplements, and everything is okay also. So there is really success stories on both sides, or else nobody will be taking chemotherapy, right? If natural doesn't work, why would anybody try? Obviously, there is a success story over there also. So right now, what we want to do is, why don't we take the best of both worlds so that your success rate is the highest, okay? So I hope that answers your question. If you're going to choose natural, honestly, I've spoken to so many natural doctors, even orthomolecular, functional science, integrative medicine. There literally is, they would tell you, there are IV vitamin C drip, ozone therapy, all sorts of different therapy. But when it comes to an oral supplement, that means something you take. I can confidently tell you that almost all of them would say Simply Nature PPAR liquid is the best. Will give you the best result, best chance when you fight or when you're doing your cancer treatment.
Yes, sir. I was actually hoping a little more about when you said that, stress is really inevitable. And for a cancer patient, there is still hope. And a lot more, of course, to those who are not diagnosed with cancer, who are also stressed and cannot get out of it, right? There.
Yes.
Thank you, sir. All right. Another question coming from Miss Joyce. She's a nurse from Taguig City. Her question is, how about for cancer prevention? Which is the best PPARS?
Okay, for cancer prevention, the best PPAR is going to be the tablet. And good news, that's the cheapest. All right, so I'm being honest here, right? I'm not saying get the most expensive. No. the best one for cancer prevention is actually the tablet. Okay, and let me share with you how it's going to help you maintain a good health and prevent you from getting cancer. Okay, so all cancer starts at metabolic syndromes. Okay, so if you are diabetic, you have high blood cholesterol, high blood cholesterol and diabetes does not cause cancer, but it is the foundation for cancer. Okay, that means if you have this, it's very easy to develop cancer. Okay, so if you don't have this, it's like Meron building a house with no foundation. Very difficult to build the house. You build the wall, it starts to be wobbly, you know, then you're like, oh my God, I'm not going to build this house. It can't stand, right? So if you don't have diabetes, you don't have blood cholesterol, you have no chronic inflammation, imagine the cancer tumor trying to grow. Very difficult to grow lung. So it's very hard. So it's very anti-cancer. It makes it very difficult for you to get cancer because your body, you don't have high blood cholesterol, you don't have blood sugar issues, all right? You have healthy kidneys and liver, your detox is very good. Now, on the reverse, if you're diabetic, your kidney functions will be affected if you're diabetic, all right? You probably develop some liver problem. If you're taking medication for your diabetes, it will lead to high blood cholesterol, and that's going to give you other problems. Now, these two together, there's going to be chronic inflammation in your body. All this will create the perfect conditions for cancer to develop. By themselves, they don't actually cause cancer. Okay, so if you want to be anti-cancer, what you want to do is to make sure all these things don't exist in your body. Then you have a very anti-cancer body. Now, this is where the Simply Nature tablets really come in. Simply Nature tablets are proven, all right, to work for metabolic syndromes. Okay, so it will make sure that your metabolic syndromes don't develop. It will lower your blood sugar. It will lower your chronic inflammation. So all these things are going to make it effective. Okay, Junie, can you let me share screen? Okay, I'm going to show something. Everybody get ready, okay? Don't be disgusted, okay? I'm going to show, yeah. Okay, I'm going to show a picture on the screen, okay? I'm just going to show a picture. We recently had, okay, look at this. I know, it's very terrible, right? Okay, I just want to share everybody the good news, all right? So we recently had a diabetic patient, all right, that the diabetes is so serious that they need to chop off the ankle. So literally the doctor was saying you have 3-4 days to decide. Okay, imagine this is a Monday. So the doctor is saying, come on, by Friday you have to decide, are we going to chop off the ankle or not? Because if you delay, if we wait until next week, we may have to chop off all the way until the knee because the gangrene will grow. Okay, it will get worse and worse. And of course, the patient could die of sepsis at any moment also. So imagine, so this is the feet. It was so terrible. They even have to graft some skin onto it already. Next week, we may have to chop off all the way already. Of course, the gang. Okay. So what happened? The patient went on soft gel capsule and tablets. Soft gel capsules and tablets. And this is what happened. Look. Okay, look. Okay, here's the crazy thing, right? 10 days. From here, where the foot needs to be cut off, to here, 10 days.
Grabe. Wow.
Grabe. No other like drug or anything. Simply Nature, soft gel capsule, and tablets. Okay, so what's happening here? Obviously, you know, like many things is happening here, right? Number one, the blood sugar must come under control or else the body cannot heal. All right, you all know, right? Diabetes, why your blood sugar needs to be low, okay? Needs to be normal, sorry, before you can go for surgery. Because if your blood sugar is very high, your wounds cannot heal.
Can proceed, yes.
They cannot proceed with the surgery. So number one, obviously, the Simply Nature soft gel capsule and tablets is managing the blood sugar. Then we talk about lowering inflammation, right? So that the wound can recover, or else always be swollen, inflamed, right? So you see the redness is not, look at this. Look at this. Look at this, right? So you can see many things are happening. Okay, obviously, the patient is also applying antibiotic cream, right, on the open wound. So you're not going to say only take Simply Nature PPAR and then tablets and soft gel. Don't even put antibiotic cream. Don't even use betadine. No, of course you have to use betadine as well because the room that you stay in may be dirty, right? And obviously, make sure the room is clean because Maron open wound, you don't want a bacterial infection. So you guys get what I'm saying? The product works very well, but you got to also make sure that you do the right thing. Okay, so I show you this because that's how you stay anti-cancer. Imagine if the food, which is only, do you think that that body will be able to fight off cancer cells? The answer is yes. If the body can fight off the gangrene and recover, then that body is probably cancer resistant also. Diba? So that is why how to stay cancer free, make sure you don't develop metabolic syndromes. Okay, make sure you don't have chronic inflammation. So that has to do with a healthy lifestyle. And if you cannot maintain a very disciplined, healthy lifestyle, then you got to make sure you use supplementation to make up for your lack of discipline or the inability to find healthy food where you work. Okay, so that's why you have to use supplementation. Then for supplementation, there's nothing better than the tablets. I will tell you, for treating cancer, the liquid is better than the tablet. But for overall nutrition and supplementation, the tablet is better than the liquid. Okay? If I'm healthy, I will eat the tablet. If I'm sick and I need to get well, I'll take the liquid. I hope that makes it clear for you. So since your question is how to be anti-cancer, so you're right now hopefully healthy, or at least you're not super sick. So yeah, you don't need the liquid. Go for the tablet, eat a lot of it and eat it regularly. And one last thing I want to encourage you is that I am 50 years old. I just turned 50 years old in September. And I've been eating the tablets for the last 23 years. So one of the benefits of the tablet is Maron anti-aging. Okay. So I take it not because I'm sick. I take it because I still want to look young. 50 is young, and I want to be energetic. Thank you. I hope that answers. Yeah.
It does. It does. Thank you, sir. Actually, this is also a very good news for those who have history, of course, of cancer, diabetes, and hypertension. So go for tablets. Okay. I guess this will be our last question for tonight, Sir Shyan. So it came from Grace Lab Cali. Question is, can we take the medicine or maybe the PPARS during treatment or after completion of treatment? I think the question is, when would be the best time to start off with PPARS?
You take it before, you take it while you're undergoing treatment, and then you take it after. Okay. The only thing you don't do is you don't take it immediately at the same time as your treatment. Okay. Okay. So what do I mean by that? Let's be more specific. For example, taking Simply Nature PPAR liquid because you're going for chemotherapy. Okay. You take your liquid the day before. On the day of the chemotherapy, you don't take the liquid. Why? Because that day, you're going to do an intravenous chemotherapy. So let that be the focus. Let that be the focus of that day. Okay, so let your body, let the chemotherapy do its job alone. Okay, and then the next day, or if for example, you do the chemotherapy and you really feel really bad. Let's say you do it at 3 p.m. or 10 a.m. in the morning in the hospital, right? And then when you come out, oh my God, you really cannot take it. And by the time in the evening, you feel like, oh my God, you really feel so bad. Then take it before you sleep, so that while you sleep, the Simply Nature PPAR liquid extract will help you recover. Okay, so that's what I mean. You take it before, you take it while you're going for treatment, and then you take it after so that you can recover quickly. So what happens if you're taking oral chemotherapy? So for oral chemotherapy, you take it more regularly. Some are actually being taken every day. So obviously there is no wait 24 hours, right? Because 24 hours later, you'll be taking another dosage of your oral chemotherapy. For that, fine, just space it out. So if you take your oral chemotherapy in the morning, then I guess wait 4 hours, right? Allow your chemotherapy to go into your system, do some work, and uninterrupted, then you take your liquid, right, to protect your healthy cells, right?
That's
and to heal
right.
the stomach. So if you're taking oral chemotherapy and if it's a daily dosage, then yeah, obviously there will be no space to break it, all right? Will the liquid extract or PPARS affect your chemotherapy, oral chemotherapy? The answer is no. Okay, the mechanism is different. And I'm actually going to do that presentation. My team is going to actually do that presentation to a group of PD oncologists. Okay, so the chemotherapy drug works by inducing apoptosis. Our product actually reduces apoptosis on the healthy cells. So the key thing that every onco wants to know is then will it protect the cancer cells from the chemotherapy, right? So you're going to ask, I'm taking tamoxifen. Is it going to protect my cancer cells from the effect of tamoxifen? Then why should I take tamoxifen if you know? So it doesn't make sense, right? So the answer is no. The mechanism, how the product works is different. Okay, so chemotherapy drugs target cancer cells. No, cancer cells and healthy cells. So chemotherapy drugs are, well, nowadays they are more targeted ones, but in the olden days, they destroy everything. All right. Now, our product also targets only healthy cells. Our product protection only works for cells with intact mitochondrial pathways. Cancer cells have distorted mitochondrial pathways. So the protective effect of the PPARS will not work on a cell that has a distorted mitochondrial pathway. That means cancer cells will not benefit from the protection. So your chemotherapy will work on the cancer cell. However, when your chemotherapy wants to attack the healthy cells have intact mitochondrial pathways, and that makes our product work. Our products will work for cells with intact mitochondrial pathways. So that is why the product will protect healthy cells but not protect cancer cells.
Thank you for clarifying that one, because it's
Okay,
actually the
got it?
fear.
Yeah,
Yes.
yeah.
It's
Yeah, I know,
actually
it's
the
very
fear.
logical fear. You will say, how can it be? You say
Yes.
that it will protect, and it will protect all, right? No, because cancer cells are different from healthy cells. So yeah, I think
Yeah.
I'll repeat myself. Okay.
Yes,
Yeah.
I just want to quickly add no. Well, there's a very reason why there's chemotherapy that's done orally and also the IV one, and it has something to do with the gravity of medication that your body is taking in. So the answer that Sir Shyan actually gave, I hope it really encourages those patients who are about to go for chemotherapy and who are also on their journey of chemotherapy. All right, well, I know that I've mentioned that was our last question, but I see here, okay, another last one
Okay,
that
if we can,
just
we
pop
try.
up.
Huh?
Okay, all right, the question is coming from Ms. Gracie. What is the protocol for colorectal cancer stage 4 metastatic to lung and liver? Oh, okay.
Okay, so for this particular viewer, you know, obviously stage 4 is not a good prognosis, right? Stage 4 means it has spread. And when it has spread, you can't do surgery anymore. So if again, this is an example. If the colorectal cancer was in stage 2, so it's even if it's spread a little, it's localized, it can be surgically removed. Now, even if you want to do surgery, you can't. All right, because it has spread to too many places. No point cutting one place only, because there is still 2 other organs that have the same cancer cells. So maybe to also help our viewers understand, metastatic to the lung and liver, it doesn't mean that this patient has lung cancer or liver cancer. It means this patient has colorectal cancer cells that spread to the lung and liver. So the patient doesn't have three cancers, right? That doesn't have lung cancer, liver cancer, and colorectal cancer. So it's literally, it really means the colorectal cancer has spread to the lung and liver. They don't have lung cancer or liver cancer. They have colorectal cancer cells in the lungs. Okay, so that's what metastasis means. All right, so because some people think that, oh, now I have 3 cancers. No, you don't. You still only have 1, but it's now at the different parts of your body. Okay, so what is the protocol? First of all, you will definitely need to go on liquid. Okay, liquid extract. So the liquid extract will also strengthen you. Okay, so if you are weak now because of the cancer, you will, after you take the liquid extract with tablets, always with tablets. Why? Okay, I said it just now, right? That if I'm healthy, I will eat the tablets. If I'm sick, I'll take the extract. Why did I say if I'm healthy, I'll take the tablets? Because the tablets have all these multivitamins, phytonutrients that are good to maintain my health. Okay, so when you're a cancer patient, especially if you are metastatic, you are probably feeling very tired. So you really still need all these nutrients. So that's why the tablets are there for that. Now, the liquid extract is actually for the fighting of the cancer itself, okay? So it's about boosting your immune response and all that. Okay, you will be on the liquid extract and tablets, okay? The liquid extract will make you strong. If it makes you strong, you might really want to consider to probably be on chemotherapy, right? Because chemotherapy will go throughout different parts of your body and it will be able to attack the colorectal cancer cells in your lungs, liver, and of course in your colon all at the same time. Okay, so that's something that you can explore. But to answer your question, the protocol would be minimum 1 liquid vial a day. Okay, take it in the morning, and then you want to take 10 micro tablets minimum 3 times a day. That means breakfast, lunch, dinner. Okay. Preferably you take 20 3 times a day. Okay, if that's not an issue for you. All right. So as much and for example, if you have no appetite, then take more tablets. Why? Because if you have no appetite to eat, then the tablets become your meal replacement. Very super powerful real meal replacement. So because you really need to have energy while you're fighting cancer. Okay. Great.
Yes.
So I answered that dosage directly.
Right. Well, I just want to say, please talk to your assigned healthcare specialist or client service officer, or might as well, you might want to go for a consult. For those of you who wish to have a consult with Dr. Jansen, you can just type in how to consult. Our pretty HCS ladies will definitely get in touch with you right away. Well, this is not a question that just popped in coming from Miss Jacqueline, but I just want to read this one. She has metabolic syndrome also, and she's looking forward for PPAR tablet to help her to be healthier.
Oh yeah, I know Jacqueline. I think she just had spent time with my wife. So I'm also looking forward to you getting back all your health. Amen. Yeah.
Amen. Amen. Well, actually, that is our last question for tonight, Sir Shyan. But of course, before we say goodbye, I'd like to ask for a very quick parting words. And as you know, the title of our webinar tonight is Cancer Care 2024. This is, of course, for the benefit of those who are on their cancer therapy or cancer journeys this year and who are, who are newly diagnosed and will be doing the rest or majority of the journey in 2025. I'd like to ask for a very quick message for them.
Parting words is, okay, I think it's very important that you try and understand the strategy or the supplements you're taking. Okay, and be able and I pray that our program allows you to provokes you to think about your approach. Like, for example, everybody thinks that to be healthy, just take multivitamins, diba? And my question will be, many of us have been taking multivitamins or vitamin C for months in our life, right? At some point of our life, maybe when you were sick or when you were in college or when you just came out to work, you walk by GNC or Healthy Options and then you say, oh, let me buy some multivitamins. I want to keep healthy. Or you saw advertisement on the TV for some multivitamin and then you tried. And then you probably did not continue. Why? Because you didn't feel any difference. Okay. And I will share with you, then you have to ask questions, right? So why are we taking multivitamins? What effect do you really want? Okay, so I want to leave by saying that today it's not about taking multivitamins. It's about knowing what effect that you want for a healthy life. Okay, so right now, because of our modern lifestyle, we really, really need anti-inflammatory. That means you need to take supplements that keep your inflammation low. Okay, so it's not a particular vitamin or a particular mineral. Okay, so it's not like vitamin C alone will keep your inflammation. No, no. It's a whole host of things. And most of the effective supplements that will be good for anti-inflammation would actually be natural products. Why? Because, for example, let's take the Philippine one. Let's not talk about PPARS, right? So that we can be impartial. Let's talk about turmeric, malunggay, all right? These are very effective. They're not effective because of the minerals and vitamins in turmeric or in malunggay. Okay, they're effective for like turmeric is very good for boosting cancer. Helping cancer patients fight cancer because of the phytonutrients. Okay, phytonutrients are unique plant botanicals. Okay, so it's not just vitamins and minerals. So what you really want to do is to take something for effect. Okay, so what effect do you want to keep young? You really want the effects of anti-inflammation. Anti-inflammation is not the same as antioxidants. Yes, oxidative stress leads to inflammation and is part of the process of inflammation, but it's not the only mechanism, right? So that's why eating healthy with managing your inflammatory response. Okay, so at the end of the day, here's the thing, we really need supplementation because our normal lifestyle does not cut it. However, in your approach to supplementation, don't just go and look for the highest IU of vitamin E, vitamin C, because you've tried that before. It has not done anything for your life, right? Which is why many times we take vitamin C, but we stop after 1 month because there was no actual change to your blood pressure, blood sugar, or your inflammation levels at all, right? So in fact, then we tried things like malunggay or turmeric. Oh, and we felt better. We felt stronger. They say, oh, wow, these things work. Yeah, correct. You are absolutely right. All right. So those are the supplements that I actually would recommend to you. You know, take supplements that are and more effective than simply just a particular vitamin B, E, or C. So I leave you with that thought, all right? And I'm happy to answer more questions next week, next Thursday. And I think we also have a Simply Nature Answers next Wednesday. Am I correct?
That's right. And I'm going to announce what are they to expect for that one.
Yeah, on our Simply Nature Answer, that's the program for you to ask about Simply Nature PPARS. And then I will go into greater detail. On this program, I try to be more fair, right? I don't only talk about Simply Nature PPARS. I will tell you the benefits of turmeric, malunggay, lifestyle change, and all of that. Even vitamin C drip. How does vitamin C drip work as a cancer treatment, right? We will talk about that. But on Simply Nature Answers, that one I will focus on our Simply Nature protocols. Thank you. Have a good weekend ahead. Thanks, Sheila. I hand it back to you.
Thank you, Sir Shyan, for answering the questions of our viewers tonight. And we look forward once again for your AMA session for next week. Okay. Well, at this point, of course, I'd like to invite everybody, as Sir Shyan mentioned, we have an upcoming what we call Simply Nature Answers that's happening on November 20 at 4 p.m. So in this episode, this is entitled Simply Nature Answers Fuel Body's Defense and Awaken Cancer-Resistant Pathways Through PPAR Activation. So we will deep dive into how PPARs can boost your body's ability to fight cancer. Okay? Also happening on the day after that, that's November 21, we will have another webinar. That's another Thursday at 7:30 p.m. The title of our webinar is Pathways to Healing Breast Cancer, Advancement to Breast Cancer Treatment and Recovery. So please stay tuned for this awesome events. And of course, once again, as our way of saying thank you for our clients who have been trusting us with their health journeys, you are in for a treat, our dear VIPs, because starting yesterday, November 13, up until November 22, that's Friday, okay, next week, we have an exciting exclusive VIP promos for our buyers in the rec option and website. So what are these? Well, you can get free sachet, 2 free sachets of Cleansing Plus for a pack of PPARS soft gel capsules. Get 5 free sachets of Cleansing Plus for 3 packs of soft gel capsules. And this is amazing. You can get a free bottle of PPARS tablet when you buy PPARS liquid or PPARS powder extract. But I'm not yet finished, okay? Exciting news for Simply Nature family. On top of our VIP promos, this is open for everybody, okay? We are offering a limited time promo that you don't want to miss because this is up until November 30 only. Shop now at our official Simply Nature website. That's www.simplynature.asia. And please ask your assigned client service officer. It may be Ms. Jhen, Ms. Daisy, or me, Sheila, for the direct link. All right. What are you getting from this one? You are actually getting a 250 peso off when you purchase Simply Nature PPARS powder extract or PPARS liquid extract. And you can also get 200 peso discount, okay, when you buy 3 packs of PPARS soft gel capsules, okay? So don't wait. This is your chance to stock up and experience the benefit of PPARS at unbeatable price, okay? Visit today and take advantage of this amazing savings. But wait, all right, I'm not yet done. There's more, okay? Our gift packages of Power Pack, which is good for 5 days, and Kickstart, which is good for 15 days, are also available for buy 10, get 1 free. I'm sure that you've been thinking about your loved ones. It may be your parents who have diabetes or hypertension. This is actually the best gift to give them this holiday season. So what are you waiting for? Okay. Now at this point, well, I just want to say all the things that you have, the insights that we have shared with you tonight is for the purpose of for you to understand the best action or the next best action that you can take for your health journeys. And with us, your victories over your health illnesses, most especially with cancer, is what keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.